Hi. Hi at the back. Hi. It is a real privilege to be invited to come and speak here. And I feel it's a huge privilege first because I listened to such amazing presentations from Penny and Sue and Andrew and Catherine. Am I falling apart? Yeah, thank you. But also to be able to share some ideas with you around the system. I've come up here because I feel you must be feeling lonely and dislocated. So I want to ask and try to answer two questions. How can we respond to the huge challenges that face us in delivering healthcare in this country, first of all? And second, what can we individually do to make a difference? So there are enormous challenges facing us in healthcare. I think in my lifetime, I've never known the NHS to be under such pressure. But in the process of trying to meet these challenges, we're also damaging the health and well-being of the people who we're asking to care for the health and well-being of those in our communities. Most NHS staff say they're not able to manage all the competing demands on their time at work. 40% report being ill as a result of stress at work during the previous year. 50% more staff in the NHS report debilitating levels of stress at work compared with people in the general working population. And we know that that has an impact on the quality of care. We know that it affects the number of errors that people make at work. We know that it affects their ability to be compassionate. We know that it affects, in the acute sector, levels of patient mortality. So what are we to do? And it's no surprise, therefore, that only a minority of NHS staff say that they feel they're able to deliver the quality of care that they want to deliver. What are we to do? Well, there are various top-down national initiatives like system transformation plans that have been mentioned this morning, the 5-year forward view, the efficiency reviews, all worthy initiatives, but I don't think they get at some of the core cultural problems which face us within the NHS. To do very often with a lack of leadership or just poor leadership. Add to this the crushing inspection and regulatory regimes that we have, and we are in danger of creating cultures not of compassion, but of blame and fear. So what are we to do? I think that we have to go back to the core of what healthcare, health and social care is all about. We have to go back to the heart of it all. When the NHS was set up by a post-war society in 1948, it was with a commitment to providing free healthcare to everyone, regardless of their wealth or their status or their background, a core national value of compassion. And we remained fiercely protective of that core value of our NHS ever since. And you and everybody, all of those who work within the NHS, made a decision at some point to dedicate an enormous part of their precious, magical, unique lives to caring for their fellow human being, caring for your fellow human being. Most of the people, all of the people in this room, most of the people who work in the NHS have as their core work value, the value of compassion. What is compassion? For me, compassion is the healthcare assistant I saw who spent an hour after her shift had ended, holding the hand of an elderly lady who was in distress and speaking with her caringly and gently until she was peaceful again. It was the GP who told me that she had danced in her surgery that day with a lonely elderly man when she discovered that they had a shared interest in dancing. Beautiful. And what does it mean in practice in terms of our behaviors? I think we kind of have an understanding that compassion has 4 elements to it: attending, understanding, empathizing, and helping. So if you'll let me, Anne, so if Anne, you're in distress, then for me to be compassionate, to have a compassionate response, the first thing is I have to be present with you. I have to be here and now. I have to use Nancy Klein's wonderful phrase, listen with fascination. And then the second is I have to have come to some understanding of the causes of your distress. Ideally, in conversation with you, we arrive at a shared understanding. The Einstein principle, spend most of the time listening and understanding. And third is then I have to have a felt, empathic response to you. I must feel your distress at some level, because then that gives me the motivation. And that's the 4th component, the motivation to help, then to take intelligent, thoughtful action to help you with your distress. Feeling better already, aren't you? So when NHS staff deliver care with compassion, patients are more satisfied, and in turn, staff feel a higher level of commitment, more satisfied, and they also feel better, they have better health and well-being. So how do we create the conditions where staff can deliver high quality, continually improving, and particularly compassionate care in this system? Well, one of the great examples locally in the Northwest is Wrightington, Wigan and Lee. They have, as an organization, as a trust, they have been really successful in raising levels of staff engagement within their organization and sustaining them over time. And I went there just over a year ago to learn about how they'd achieved this. So I sat in their engagement committee for a couple of hours, and they kept talking about the horse. So I asked, what's this about a horse? And they told me the story of Sheila Marsh. Many of you will be familiar with this story, who was sadly dying on the palliative care ward and had a few hours left to live. And one of the nursing staff asked her if there was anything they could do for her. And she said she wanted to see Bronwyn one last time. And it turned out that Bronwyn was a horse that she'd raised from the time it was a foal, 25 years previously. She'd worked at Haydock Park racecourse for most of her adult life. So the nursing staff called the family and said, can you bring Bronwyn in? And they arranged a horse box, and the staff arranged for Sheila Marsh to be taken out into the car park on her bed. And the horse was brought in, clearly recognized her. She called the horse, and it came over, leaned down, nuzzled her, and kissed her. It's a really powerful, moving moment, captured by somebody on a camera phone, and has been seen by more than 5 million people around the world. No one called health and safety. No one checked with Andrew Foster, the chief executive, is it all right if we do this? Because there was a culture of compassion, staff did the right thing, and they were supported. And it was an affirming and moving moment for Sheila Marsh herself, who sadly died a few hours later. It was very moving for her family, and also very powerful and affirming for the staff. I believe it was probably affirming for Bronwyn as well. The question is, how do we create the conditions in our organizations where we have cultures of compassion? And what we know about cultures is that every interaction by every one of us every day in our organizations shapes the culture of the organizations. But what leaders do is particularly powerful. We pay attention to leaders. What they focus on, what they talk about, what they reward, what they pay attention to, tells us what's valued within the organization. So, because leaders carry the values of the cultures of our organizations, we need them to embody compassionate cultures in their leadership. What we need in essence is compassionate leadership. And when you think of those four elements, there are four components of compassionate leadership. First is leaders paying attention to the other, listening to the people they lead, listening with fascination. It means leaders listening to learn about the difficulties, the frustrations, the challenges, the hurts, and of course the delights and successes that staff experience. It means leaders taking the time to understand the challenges that those they lead face. Ideally, as I said, a shared understanding in order that it's both more accurate and more helpful. And third, it's leaders empathizing with those they lead. Remember those statistics I talked about earlier in terms of levels of stress? It means leaders empathizing, being emotionally in touch with those they lead, while being able to tolerate rather than over-identify with distressed emotions, for example. And it means leaders then being motivated to help staff. That's what leadership is supporting those we lead to achieve what it is they want to achieve. High quality, continually improving and compassionate care. And this also implies a leadership that is collective. So leadership where everyone sees that they have leadership responsibility within their organizations to do the right thing. Shared leadership rather than dominant leadership in teams, with team members supporting each other and being compassionate in their relationships with each other. It means leaders working interdependently across boundaries to ensure high quality care and compassionate care for patients overall, not just in their own individual area. And it means consistent approaches to leadership across our organizations, characterized by authenticity, by openness, by curiosity. How can I lead better? By kindness, by appreciation, and above all, by compassion. This doesn't mean that we need leaders who always do everything that their staff, those they lead, want them to do. Leadership sometimes means going against the wishes of our followers. So for me, one of probably the most inspiring example in my lifetime was seeing what happened when Nelson Mandela was released from Robben Island in 1990. The ANC now had their leader and could go to war with the apartheid regime and to confront the excesses of the Inkatha Freedom Party of the Zulu people. Terrible atrocities were being committed across the country. But Mandela went against the wishes of his followers and said, we will negotiate. We will focus on reconciliation. We will focus on truth. And through his commitment to compassion for the nation, for the community as a whole, he succeeded in avoiding the terrible civil war that every onlooker thought was inevitable in that country. So we need compassionate leadership to be modeled by every leader at every level within the NHS, to embody the core value of compassion of this sector, this system, this service. And that means not just individual leaders, but the way the regulatory and inspection bodies behave towards the organizations within the system. We're currently devising the new National Improvement and Leadership Development strategy and pushing very hard for a commitment to compassionate leadership at every level, from every leader at every level and between organizations. And when staff are able to be compassionate in the care they deliver, when they experience compassionate cultures every day, 1.4 million people, they go back out into their families and their communities and spread that compassion, behave in more compassionate ways within their families and within their communities. And when the 1 million patients who are served by the NHS every 36 hours experience compassionate care, through those processes of emotional contagion, the ripples of compassion spread out into our society. The promise is enormous. So at a system level, we have to create cultures of compassion through compassionate leadership. And what each of us individually can do is to focus on those 4 behaviours in our interactions, of course, with patients, service users, but also with other members of staff and members of the public in the course of our day-to-day work, because every interaction by every individual every day shapes the culture of the organisation. But in order to do that, we must first practice self-compassion in order that we have the capacity and the resilience to be compassionate to others. That means paying attention to ourselves, listening with fascination to ourselves, understanding the challenges that we face in our lives and in our work, empathizing with ourselves, caring for ourselves, and then taking action to help ourselves in order that we can be who we can be, and stay close to the core values like compassion that give our lives meaning and enable us to achieve a deeper connection with all. Thank you very much.